All right, give me 1 second. Sorry, we're having some difficulties here.
It's okay.
Oh, okay. Now we're okay. So, hello everyone. So today we're joined by Dr. Neelab Anwar, an orthodontist based in California. So, thank you so much for joining us, Dr. Anwar. And whenever you're ready, the floor is yours.
Awesome. Hi, everyone. My name's Dr. Neelab Anwar. I'm happy to be here. I love just sharing my experience and journey with you guys. I wish we had stuff like this back when I was in school, but just think of any questions you guys have and hopefully we'll address them all after. Okay. Just to start, I am a board certified orthodontist, pretty much born in Southern California in San Diego. I grew up in Orange County, if you guys are familiar with this area. And then we moved to a town north of San Diego in Temecula. And then I commuted from home for my undergrad. I went to a local state university for college. And then I got into dental school right away at USC in Los Angeles. And then I got into my ortho program in upstate New York, Rochester. And then I worked there for a year after in Buffalo, New York. And kind of full circle, now I'm back home. It's awesome to be here in the San Diego area. So I'm super excited for what the future holds. My husband's also an orthodontist. We met in ortho residency. He's actually from the East Coast originally, and so that was really awesome. In my free time, I love playing tennis and the piano. I have a huge family, huge extended family here, and just love traveling when I have time. And yeah, that's pretty much about me. So a lot of you guys have questions as far as why did I choose dentistry? How did I even choose orthodontics? So as far as ortho goes, I had braces myself when I was 14. And just when I had them off, just the self-esteem boost and my confidence just dramatically increased. It was a huge change in my life. And I thought, well, if you can do this for every individual, every patient, that's truly amazing and gratifying. And also in orthodontics, I don't know, many of you have probably had braces before, but your treatment times average 1.5 to 2 years. So you really get to know the parent and their family super well. And then also the lifestyle flexibility with your schedule as an orthodontist is really great. I'll go more into this later. But it's a really great field. And with orthodontics, you know, a lot of people, they typically come in excited and they don't come in fearful or scared, you know, like they're about to get a shot or anything. And there's no traumatic, you know, emergencies, or it's a very clean field. So that's pretty much why I chose orthodontics. And then how I even got into the dental field, ever since I was a little girl, I've had aunts and uncles, they're all general dentists, and I always just saw them happy, and I would be in their office a lot. So I wanted to see more of what they did, and I just love the patient relationships and just working with my hands. But honestly, ever since I was little, I truly loved dentistry, and then ortho, I would say around 14, 15 years old. So my journey in becoming an orthodontist. So graduated from high school in 2010, went to a state university, finished in 4 years, Dental school is another 4 years, went right after. And then I got into my dream ortho school right after dental school. My ortho program was 2 years. So most orthodontic residencies are 2 to 3 years. One thing I want you guys to keep in mind is you can see that I did go straight through school. Okay. But this is not the norm nowadays. Okay. And there's no right or wrong either. But I know a lot of my friends, after their 4 years of college, they took a gap year, to study for the DAT and apply, or they did a research fellowship for a year. I know friends who applied 3 times to dental school. Okay, now, and 2-3 years out, now she wants to be an orthodontist. So like I said, there's many different journeys. Even my husband in his ortho class, there was a father of 3, who he was in the war in Iraq and then went to school. He was an engineer and then now he's an orthodontist. So just wanted to tell you guys that there's many different paths and there's no right or wrong. And so I don't want you guys to get discouraged, and just every path is beautiful in their own ways. Okay, and I'll go more into this. So I broke it down into my college years. So those of you who are in college right now, kind of where your mind should be. I majored in bio with an emphasis in physiology. Right off the get-go, I tried to join the Predental Society. I was a VP, took on many different leadership roles. I was a science tutor, so I tutored OChem, chemistry, biostatistics, calculus. And then while you're in college, you should be shadowing general dentists, right? Because you're interested clearly in dental school. So you want to make sure you love what you're doing or you love what you're getting into. Let's say even if you want to be an orthodontist or oral surgeon in the future, you want to kind of do one thing at a time. So shadow a lot of different dentists, make sure you love that. And then I also was involved in many different service projects. I was always at a low income dental clinic. I went there like twice a week in college and I assisted there. I saw many different procedures. I poured up impressions and everything like that for the dentists. I graduated with honors. And then I knew, like I said, I wanted to get into dental school right after college. So I took my DAT my 3rd year. Okay. You want to score well on that. I'd say anything above a 20 is good. Okay. As far as the subjects for the DAT, I don't think much has changed, but it's like perceptual ability, it's chemistry, you have like reading, but yeah, it should be, honestly, I studied for, I'd say like 3 months or so. I know some people do like a hardcore review. They just study 3-4 weeks. So honestly, as long as you guys are focused for a good few months, you should do just fine on that test. And then in my dental school I went to in Los Angeles, class I had about 185 to 140 people. It's been a little overwhelming at times because you have people all trying to do the same specialize. So for me, this is where I wanted to go all out and focus on, or people want to be oral surgeons. So for me, right when I started dental school, I made sure I went to the Ortho study club, that I volunteered. I tried to take on many different leadership roles in different groups. And then I shadowed many different orthodontists while I was, if you want to specialize. So I was published. So I worked on that again from year 1 of dental school. And then let's say you want to specialize, you want to apply for residency at least a year before you graduate if you want to get in right away after your 4 years. Okay. And then for orthodontics programs, some schools require the GRE. So I took that my 2nd year of dental school. For each orthodontic program, though, they have different requirements. So you want to be organized with that. Some schools need the GRE, some schools don't. Okay. And then I applied for ortho the summer of my third year to make sure I get in right away. I broke down the years of dental school because a lot of you ask, well, what do we even do all 4 years of dental school? Each school is different, but typically the first 2 years, you have a lot of studying and you have a lot of lab work. Lab work means you're drilling on plastic teeth in the laboratory, you're training your hand skills. So you're ready for treating patients third year of dental school, okay? So the first 2 years are actually really tough. It can get overwhelming at times, especially when you have many people, just all in the same boat. You don't want to compare yourself to others. So my big thing would be to just keep your head down and really just make a schedule for yourself. Make a schedule for studying for your exams and classes, and then also while training your hand skills in the lab. So you want to really balance your time. It's a lot of time management. And then second year, it's cool because you focus on the different specialties, orthodontics, oral surgery, periodontics, pediatric dentistry. There's a lot you can do in dentistry, which people don't know about. So you can kind of learn more about the different fields, again, shadow. And then you obviously want to do well in the lab. Otherwise, they won't let you treat patients your third and fourth year. Third year was probably my favorite because you finally get to see patients, and I love just that one-on-one interaction with them. So it's really awesome. You have probably a list of things you have to accomplish before graduating, whether it's dentures, you have to do crowns, you have to do cleanings, you have to do like your different rotations with service projects. So it's a lot to do, but it's fun because you're treating patients. You kind of actually feel like a doctor. And then this is something that has changed since I was in school. So when I was in dental school, I had 2 different national boards, part 1 and part 2. Now there's one integrated exam. And I believe you take it year 3, but you guys will learn more about. Nice that they compiled both exams for you guys. So that's a big change. And then year 4, this is when a lot of people get senioritis, but it's pretty much finishing clinic requirements. For me, I was going on interviews for orthodontics fall of my senior year of dental school. If you want to be a general dentist, you want to find jobs around this time. Okay. If you want to specialize, but you still don't know what you want to do, then keep shadowing. Okay. So a lot of people always ask me, well, when did you decide, or when do you typically decide, 3 or 4? If you do want to get in right away again, then you want to decide ideally like your second year of dental school, what you want to specialize in, because you need to get your resume ready. You need to have a CV, you need to have a personal statement. So a lot to do for these residency programs again. Okay, so orthodontics residency, that was probably the height of my whole educational career. I had a dream goal. Why was it?
Wait, what happened to your audio?
Can you hear me, Dr. Anwar?
Can you guys see my screen?
Not anymore. There we go.
Okay. I think we disconnected there, but I'll continue. So pretty much I was talking about ortho residency. So pretty much this was the highlight of my career because I got in my dream program Why was it my dream program? Well, it was 2 years. Most ortho residencies are 2.5 or 3 years. And I did have a stipend. So it's nice that I was paid to go to my program. Many ortho residencies are not paid. They can be 100,000, 200,000, almost 300,000, in addition to dental school. So this was a great, so I got really lucky. Most ortho programs only have 4 to 10 spots. My program had 6 spots. 2 out of the 6 were reserved for international candidates. In ortho residency, so I started about 85 to 90 of my own cases, and then you treat about 45 to 50 transfer cases from your big sib. Big sib is the person above you. It is very competitive. I would say orthodontics and oral surgery are the 2 most competitive specialties. But you know, it is doable if you work hard. What do we do in ortho residency? You treat patients. You're pretty much an orthodontist and they treat you like one. So you see patients throughout the day. You do have some lectures, you do a research project, and then we do have board exams as well. You have 1 board exam, and then if you want to be board certified after graduation, you can take that as well. And then you apply for jobs. Ortho residency was great because you're in an intimate class setting, and these people that you meet are your lifelong friends. Okay. And I happened to meet my husband in residency. So, and he was from across the country, from the DC area. So you never know, but all these people, it's really nice because you become so close, and you have a ton of conferences, and you have a wire bending course in Arizona that you go to. All these different orthodontic companies, sales companies, they want to take you. The bottom pick was in Wisconsin. The American Association of Orthodontists conference, that's every year. So it's just a really, really nice time, and you're finally doing what you've always wanted to do. So I think that was the highlight of my education. My advice for pre-dental students, just is obviously having an idea of what you want to do before coming to dental school will help, because dental school, like I said, could be overwhelming. Okay. Just be involved, well-rounded. To be an orthodontist, we like to see the overall package. So we just don't want somebody who's strictly like a robot into schoolwork. We want to see people who have had experience with serving their communities, who are good with people, who can interact with their patients, because I'll explain later, but in orthodontics, you're seeing about 40 to, you can see 80 patients, 100 patients a day. So you want to really, really interact well with them. So being well-rounded is huge. Have some sort of healthy stress release for you guys when you're in dental school, college, whether it's watching your favorite TV shows, going to the gym, playing sports or music. And ideally, I would finalize your specialty by 2nd year of dental school, if you want to get in, obviously, right after those 4 years to residency. Don't forget to enjoy the journey, because this is a big investment of your time going into dental school and specializing. So don't forget to enjoy this process. Enjoy the little moments, because it really will fly by. So what is orthodontics? What exactly do I do? So orthodontics, it's a specialty of dentistry that we're dealing with diagnosing, preventing, correcting not only misaligned teeth, but also misaligned jaws as well. So we can diagnose, prevent, intercept, and treat dental and facial irregularities. Not only do we fix teeth that are crowded, but we can also, like I said, correct mismatched jaws, which is really cool. It's nice that we can treat existing problems that are there, but we can also identify problems that are developing or identify things that could potentially get worse. Okay. And it's nice that with orthodontics, we do treat patients of all ages, so children, teens, and adults. So you guys have probably had braces, many of you, but we deal with metal braces, clear braces, clear aligners, as you can see. It's nice. We also can do early treatment. Early treatment means that we can treat children ages, I mean, they can be as young as 6 to 9 years old. When we would do early treatment is when there's a severe problem that's going on or that it could get worse. If you guys can see my cursor here, do you see the middle photo? Pretty much top teeth are here, bottom teeth are here. As you keep hitting on like that, the gum line can get lower and you can lose those lower front teeth. So a lot of children, this is called an anterior crossbite. And if you were to leave that alone, those lower teeth can get loose. So it's nice that we can actually interfere with some braces. I'll show you guys a case later on, and we can really, really help them out. Also, if they have habits like thumb sucking, you don't want a big open bite. So we can help with that as well. Also with a lower jaw that's too far out or too far back, we can help the oral surgeons prepare them for surgery to fix that jaw discrepancy. So it's nice we work hand in hand with oral surgeons to fix misaligned jaws. So a day in the life of an orthodontist. So it's kind of what you see in this picture here. It's a lot of thinking on the fly, critical thinking. It's a lot of like puzzles, which is awesome. A lot of problem solving. Okay. And it's a lot of talking to patients as well. So pretty much I see right now about 30 to 60 patients a day. It depends on the day. Okay. But like I said, you can see 70, 80, up to 100. We're also very lucky in orthodontics. Having a good staff is so important because they will deal with a lot of the manual work. So like tying in the patients, taking x-ray, doing the scan, so they can help with making your day go by very smooth. And I'll go more into this, but also as a woman, it's very nice because orthodontics, it's not strenuous on your body. It's a lot of like talking, you walk chair to chair, you're thinking on the fly. It's not like you're sitting there drilling, for hours. It's not strenuous on your back. So that's also really nice. Like I said, right now, I'm working at 2 different locations, corporate locations. They're dental offices with orthodontics there. Pretty much in the morning, I will do my bondings, consults, adjustments. In the afternoon, we'll pretty much have everything except typically bondings earlier in the day. In the afternoon, I'll go more into this, but we see retainer checks. We have consults, debonds, adjustments. So I want to go into the appointment type. So consults are huge for us. So these are when we see new patients, typically. They can be children's, teens, or adults who see us for the first time. Maybe they've been referred by the dentist or a specialist. Maybe there's something they dislike about their smile, or maybe they just want more info. Typically, what we do is we take a panoramic x-ray, as you can see here, showing all the teeth. And then if they want to sign up for treatment, we can get started that same day. We take photos and the other cephalometric x-ray, or they'll come back next time and we'll take photos, one more x-ray, and get started. If they want clear liners, we can take a 3D scan with an iTero scanner or a Trios 3-sheet scanner, as you can see here. It's nice. Now we've become fully digital in orthodontics. There's no more goopy impressions. In our practice, it's all 3D. So it's really, really great. Bondings and debondings. Bondings are the most exciting, and debondings, very exciting, is when we take the braces off. Bondings, when we put the braces on, it's super exciting. The patients are typically like, they're very excited, and they get to choose what colors they want. It's typically 1 hour because we take photos, we take starting x-rays, and we like to prepare the teeth so it's nice and dry. And the materials used, it's almost similar to preparing for a cavity, but in ortho, it's different concentrations. And you want to make sure you do a really good job with placing the brackets, because it plays a huge role in how the teeth move and then how smooth the treatment goes. Okay. And then deep bonds, nothing hurts when we remove the braces. It's pretty much true. We polish, make sure it's nice and clean. And it's just a really, really gratifying adjustments. Where you colors. But actually at this appointment, a lot goes on because the orthodontist to make a decision how to prove sizes and when to which size. But
So I think Dr. Anwar lost connection, so we'll try to get in touch with her. Give us 1 second. Welcome back, doctor.
can you guys see my screen?
Yep.
Okay. All right. So adjustments, like I said, it's pretty much changing the wire, and we have to see how they're progressing with treatment. So you're either going to move up in wires, you're either going to start closing spaces. So it's really exciting. And then we see patients every 6 to 8 weeks, typically. Towards the end of their treatment, we'll see them every 4 to 6 weeks. And then typically these appointments are 30 minutes or less. Other appointments we have retainer checks. So you can see the types of retainers here. We have records appointments. So that's when we do the 3D scan, some photos, x-rays. Observation appointments are when we see if they're ready for braces or not. So maybe they need more of their adult teeth to come in. Okay. Maybe we need to wait another 6 months until, they're ready for treatment. Checking an appliance. So you can see here, this is an expander, or we're using a habit appliance. So those are quick checks. Emergencies, it's nice. There's no, real traumatic injuries with braces. The worst that can happen is a wire poking or a broken bracket, all of which can easily be fixed. Okay. Salary and adjuncts to the profession. I include this because many people don't realize as an orthodontist, there's many different paths or things that you can do. You can work in a private office. You can work as a corporate associate, which means you're working part of a big dental group. Or you can own your own practice, okay? Or you can partner with a pediatric dentist. Another thing you can do if you don't want to work clinically, you can also teach at an orthodontics residency program. There's different routes you can do, also depends on the lifestyle you want. But it's nice that as an orthodontist, like I was saying, you can be very successful and work 3 to 4 days a week. And it's not really the case with other specialties. With orthodontics, it's nice that you can do well and have a good lifestyle, and also owning your own practice. You have that flexibility. I know some offices that they're open like 3 days a week, 4 days, and they have really nice hours, because in orthodontics, the way you schedule or manage your day is important. And I don't want to get too much into that, but it's nice you have that flexibility. Technology in our field. It's an exciting time, like I was saying, because we're truly digital. This cool gadget here is a 3D printer. Okay, so pretty much the workflow is you can scan a patient with your 3D scanner, you see their model. What I can do from my laptop using a software is to plan how I want their teeth to move. And then all I have to do is send it to the printer. This printer will print these, you see these models here, pretty much it'll print these models, and then I can polish and trim these so you have clear trays that can move your teeth. So it's really awesome. You can also do indirect bonding, which you can see here. What you can do, same thing, you scan the patient, plan how you want the teeth to move online, and then pretty much a software can place brackets in these silicone trays, and then you can place all the braces at one time. So it's a lot going on, but it's very exciting, something to look forward to. As far as the future of orthodontics, some people say, oh, are you worried? There's a lot of other general dentists doing ortho. There's a lot of those companies. You guys see probably commercials, Smile Direct Club out there. At the end of the day, we are specialists. We went through extra training to be an orthodontist and really studied hard for this. And also not only the education, but you need to set yourself apart. So as an orthodontic specialist, there's so many in the area, but you need to set yourself apart. What makes you unique, or why should patients come to you? That will really, set you apart, and you'll do well. You don't have to worry about, other people doing what you're doing. And it comes down to that. And like I said, technology is booming. So that's a lot to look forward to. Now I'll go through some cases with you guys. So what do patients generally present with? They can come in with, you can see here, a lot of crowding, overlapping of some teeth. And you can see here, everything's nice and aligned. And then after treatment, we give them retainers. If you can see here on the right, like I was saying, these are both early treatment cases. So I think this patient was 9 years old. Like I said, these bottom teeth can become loose. It is so gratifying that we were able to fix this, and you close the spaces there, and now he doesn't have that trauma to the bottom teeth. And how did we fix this? We typically put these little bite pillows on the back of their teeth. It's like these blue little bumps. And then we put braces, typically on the front 4 teeth. Sometimes if we need to, we'll put on the front 4 bottom, but it's a really quick fix. We've had results within 3 months, max 6-7 months. On the bottom here, you can see this patient could barely eat. I think another 9-year-old, and he had a thumb sucking habit. So you can see that caused this open bite here. And pretty much we were able to fix this with an appliance and then some braces to bring his teeth down. So this was a surgical case that I worked on with an oral surgeon in residency. So pretty much you can see lower jaw more far out. You can see here, the bite is not fitting really nicely. You can see she has a cross bite, we call it. You can see that the lower teeth are far forward than the top teeth. You can also see here what we call her laterals are smaller shape. They're called peg laterals. So a lot going on here. But what we do as the orthodontist is we prepare the case for the oral surgeon. We put braces on the top teeth. We put braces on the bottom teeth, get everything ready, and then they go to the oral surgeon for jaw surgery. So this is after surgery, which honestly is amazing. She was really happy. This was before her buildups of the peg laterals, but the general dentist will do that typically towards the end of her treatment. These cases are the most gratifying because you just see a huge change in her self-esteem and just her bite. You can see that it almost fits like a nice puzzle, and it's just occluding so nicely, and just her profile, she was really happy with everything. So it's super, super gratifying. Another case, Huge anterior crossbite you can see here. This case was not surgical. I don't want to get too into the details, but you guys will learn in orthodontics residency when a case is surgical and when can it be fixed with braces. So in this case, I said, well, why don't we try braces, rubber bands to bring his lower jaw back? And also we tried an appliance called a Carriere appliance, and I'll show you guys that as well. Wanted to go over this x-ray because this is a really awesome radiograph we use in our field. The creator of this x-ray actually went to my orthodontics program, Dr. Fishman. And pretty much with this x-ray, it's called a hand wrist radiograph. You can see where the patient is at with growth based on the fusing of these bones. So it's really awesome. So this patient had a skeletal maturity index of 7. So that means they're around their peak puberty or towards the end of growth. This you'll learn as well in residency. So a lot of numbers, a lot of angles going on, but it's nice that each line, each number depicts a measurement of whether it's their jaw position, their lower jaw position, their upper tooth position, lower tooth position. You can see here, these are a lot of things that we look at as an orthodontist to make a really nice treatment plan for them. So what we did for his case, these were the little bite pillows I was talking about, but to kind of open their bite, but put on braces on the top. We use this Carriere bar appliance and rubber bands. Also compliance, a good patient makes a big difference in ortho because if they did not wear the rubber bands, we wouldn't have gotten such a nice result. Pretty much you can see here, top and bottom teeth are fitting beautifully together. I wish I had the final photos, but this is honestly like he can eat, better. Even the way his face looked. I mean, he was so happy with everything, and you guys can make a really big impact. So it was a really, really good case. Another case. So you can see some crowding on the top. On the bottom, so take a look at, you can see both of those, we call them incisors. They're completely out of the arch. So in some cases, you might need to take some teeth out to make things fit together nicely. Sometimes we would have to take out, you can see these premolars here, or it can be just one tooth on the bottom. In this case, we took out one lower incisor, and you guys will see the ending results here. He was so happy. Honestly, it's a huge difference for the patient as well. And also sometimes when patients have a lot of overlapping like that, it's really hard to clean back there. So if I were to go back, there was always a lot of buildup. Some teeth, you can get cavities. They would need to get deep cleaning. So with orthodontics, it's nice when you make things aligned. It's just so much easier to floss and clean as well. Last case, if you guys take a look here, lower jaw's very far back. Okay, so in this case, there was a lot going on. We wanted to bring the lower jaw forward. You can see a lot of crowding, a lot of overlapping of the teeth here. And what you guys can't see is, I don't know if you can see in this x-ray, her top teeth are like this, bottom teeth are like this. Sometimes you don't want to flare these teeth out to get the root out of the bone. So you want to keep things very healthy as far as their bone level. So in this case, we had to remove 2 premolars on the top, 2 teeth from the bottom. So these 2 here, these 2 here. And we also used an appliance called a Herbst. This appliance works really beautifully. It's like a telescopic mechanism that exerts a force on the lower jaw. And she wore this appliance for like about 8 to 9 months. And you can see her outcome here. And take a look at her lower jaw too, how balanced her face is. In orthodontics, we do look a lot at the overall profile. So you can see a big improvement there. Alignment of her upper teeth, her lower teeth, and everything's fitting really, really nicely. So this was a good case. Some general advice. don't give up on what seems impossible. Some people were like, oh, ortho is impossible to, you have to be in the top, 2% to get in, and it's just impossible. I didn't get discouraged. I really worked hard, and I really tried my best in everything. And do not compare yourself to others, because in dental school, like I said, you have 140 other people trying to do what you want, or they're becoming dentists, they want to specialize. You just have to keep your head down and do you. Write down your goals and make timelines. Starting college, I would make a timeline. It doesn't matter if you want to get in right away, but I would really just stay organized and say, okay, I'm graduating college this year, I'll take my DAT next year. I'm doing research now, I'll shadow this time. I would just really, honestly, if you're not like a writer like I am, you can put it on your phone or do a little note sheet, whatever you have to do to stay on track, because things can kind of get overwhelming sometimes, especially if you do want to study further. You want to keep everything organized. Stay positive, enjoy the journey, because like I said, it does fly by. So just got married July 2nd. We are excited for the future, my husband and I. A lot of exciting things are in the works right now. We might have our own office one day, so we're super, super happy to serve our San Diego community. We just made a new professional page this past October, so any question you guys have, just message us anytime. We love hearing from you guys. It's nice hearing from some predents. Somebody just got into ortho residency, so it's nice that they share that with us, and we'd love to stay in touch with you guys. Yeah, so like I said, just feel free to message, and thank you guys for your time. I think the internet was bad here, so I apologize.
Thank you for your presentation, Doctor.
Thank you
Can
guys.
you hear me? Oh, okay. Okay, so we do have some questions prepared for you to add for you. So our first question is, did you consider any other dental schools when you were applying as a pre-dental student?
I did, yeah. So I actually I got into a few other schools in addition to USC and LA, but I'm super family oriented, and I ended up choosing the closest program to my family. And I don't regret it. One thing I would keep in mind, though, for the future is, I think financially, my school is really expensive. So obviously you guys will have to take some loans. But it's nice with my ortho residency, I got lucky with that. So as long as you guys kind of manage like your finances, and like my husband, he went to University of Maryland for dental school and for his undergrad, and those are both in-state programs, so he was able to save a lot. So it's kind of, up to the individual, but yeah, that's kind of my journey.
Thank you, doctor. So my following question is, for pre-dental students that are trying to go into the orthodontic or even the oral surgery field, would you recommend them applying to dental schools that have a pass-fail system or a grade system?
So that's a really good question. For me, my school was graded. It wasn't pass-fail, so I don't know much about the pass-fail system. My school also didn't have rankings, but I think UCLA was pass-fail and they did have rankings. My husband's school also had rankings. So I think having the ranking helps, but I think either or is fine from what I've heard from my colleagues and everything like that. As long as you do really well with your academics, you will be fine. So keeping your GPA above a 3.5, above a 3.6 ideally, is really, really good. And if you want to be an orthodontist, oral surgeon, as long as you take the proper exams and then you're shadowing, you have a good CV and personal statement, letters of recommendation, those all will help you. So at the end of the day, it will come down to that.
So we have one more question for you. So during our dental shadowing sessions, like if we were going in person, what should we look for?
That's a good question. So when you guys are shadowing, hopefully you guys can go in more too soon. I know it's been difficult with COVID, but when you guys go into these offices, first of all, just see if you can imagine yourself doing this for the rest of your life. Kind of picture yourself there. And usually some people get that feeling like, hey, this is what I want to do. This maybe isn't what I want to do. And then throughout the day, kind of observe the dentist. You can ask them about their journey, see what schools they went to, what they did to prepare, what was their routes. Did they go into residency right away, or did they become a dentist right away? I would ask how many patients they see, what's their typical work day like. One thing I didn't discuss is also work-life balance. So like as a mom, for example, how do they manage time with their kids? Questions like that, or what do they like to do in their free time? Because it's also important to have a really nice balance. So I would ask questions like that, and I would see them as much as you can. You can go like for morning or afternoon time. You guys don't have to like stay all day necessarily, but I would typically choose a time point in the day. And also I wouldn't want to get in the dentist or orthodontist way. So I'd always like ask before like they were seeing patients like, hey, is it okay if I observe this? Because sometimes they would want you to kind of stay in the distance or whatnot. So those are just some things to keep in mind.
Okay. Thank you so much, doctor, for your time. I think that's all the questions we have for today because due to your amazing presentation. And once again, thank you for joining us.
Thank you guys so much for having me.
And we appreciate you taking the time to speak to us. Thank you so much.
Thank you guys. Good luck with everything.